part of it that I want to talk about it. The title was investigating the outcomes of different methods of weaning in children covered by health centers affiliated to Tehran University of Medical Science. As we know that breastfeeding is very important for infants and children. It's the optimal form of feeding, and it protects infants from a wide array of infections and non-infectious diseases, and it has short-term and long-term benefits for development of the baby's nervous system. Also, it is beneficial for mothers. It reduces the risk of the diseases such as allergies, such as chronic diseases, for children, sorry, and for mothers also anemia and unwanted pregnancy, and also some cancers like ovarian and breast cancer. Then we go to the definition of the weaning. The reason that I chose this subject was that I was working in a clinic and I saw many women that are coming to us with breastfeeding complications, but there was really like lack of information, and they were using so many traditional methods that I am not sure if they are using that in Western countries as well. So it made me think about them, that if anybody has really investigated these traditional methods. The term weaning comes from the Anglo-Saxon word weaning, meaning to become accustomed to something different. Weaning from the breast is a natural, inevitable stage in child's development, and it's a complex process involving nutritional, immunological, and psychological adjustment. And weaning in different resources has different meanings. It can be abrupt, it can be like gradual, but here we were focusing on the type of weaning that is planned. It's mother-led. It means that mother decides to terminate the breastfeeding and thinks that breastfeeding is enough for the child. But we have also a type of weaning that is infant-led weaning, which is based on the clues that mother gets from the child to see that infants, for example, is less interested in breast milk. So it's a more natural way, and research shows that it can be a better way for weaning. But here our focus was the mother-led weaning. And about the weaning age, that's what time mothers decide to wean their children. So there are many different ages mentioned, but it should be a decision between mother and child. There is no correct or wrong, but traditionally children are weaned between 2 and 4 years, and in different countries there are different practices, but the recommendations is that the appropriate time for weaning is 2 years and beyond according to WHO, and 1 year and beyond according to the American Academy of Pediatrics. And in low-income countries, actually the duration of breastfeeding was more, and it was like very different from what we expected. In resources, you see that the prevalence of breastfeeding at 12 months in low-income countries are still not enough, but more than high-income countries. And the average of duration of weaning in Iran was estimated to be around 2 years, because we have some cultural and traditional medicine that recommends for 2 years, and also because it's an Islamic country, and in Islamic sources it's recommended to continue breastfeeding for 2 years. Many mothers practice that, as we see in different articles, that the mean age of weaning is very close to 2 years. Talking about weaning methods, there are very different methods that are used by mothers. Some of them are more frequent and some of them less. Usually these methods are suggested by friends, family, and grandmother, and people who normally don't have health education. Um, in Iran and Middle East, usually mothers use traditional methods of weaning. For example, in Iran, the weaning methods are divided to 4 different methods. Either they use a substance to make the taste of the milk bad or bitter, or they separate the mother from the child, or they cover the breast and give a special food to the child. And some of these methods that are mentioned in different research are including lipsticks, applying toothpaste, putting cotton or wool on the breast, using herbal medication, or using nail polish. These colors are used to scare the baby, and also seasoning using different spices. Something that was worked on was weaning methods. We had a few references that they were mentioning what kind of methods they were using in Iran and also developing countries like Turkey, but weaning outcomes was not really investigated. Weaning outcomes in the articles were mostly mentioned to be negative outcomes. Um, in the study was mentioned that 60% of mothers who stopped breastfeeding had some problems and complications like infant nutrition, and they didn't know how to handle the weaning. In contrast to natural weaning, an incorrect weaning method can undermine the positive effect of breastfeeding and can be a kind of obstacle between mother and baby's bond. And a few studies have determined that improper use of these traditional methods can have some bad outcomes for the child, and also it is suggested that it can make it difficult for the child to bond with the mother. So how we conducted the research, it was a retrospective study that was conducted in 2020 in health centers affiliated to to the University of Tehran. And these centers were mostly in poor areas of Iran. And we got the ethic approval of the ethic committee of nursing and midwifery faculty. The inclusion criteria were to be the child should be at least 6 months old, and they shouldn't have any chronic or pediatric diseases that cause weight loss or jaundice or diarrhea. Having a singleton pregnancy was for mother. Having ability for mother to remember the method of the weaning, and also was the initial decision for mother to breastfeed and successful initiation of breastfeeding. And we also just took the mothers who were just breastfeeding and not using formula and breast milk at the same time. And also the child shouldn't have any abnormalities. In the research population were diets of mother and children that were referred to these health centers, and we use multi-stage cluster sampling, and after that we had 420 mothers that we selected with this method, and all the selections were random. The data collection tool was a questionnaire that was made by researcher, but we did the validity of the questionnaire with the opinion of a neonatologist and reproductive health experts and some of the writers of the previous articles that we could reach them, and they had some opinions about the questionnaire, so the questions were checked. And finally, we analyzed the data with SPSS 27 software and using descriptive statistic methods. In a result, we saw that the mean age of the mothers was 29.9, and most of the mothers had university educations, and most of the mothers were also working at home, so they were not working outside of the house. And most of the mothers were also experiencing their first pregnancy, and the mean age for the children was 42.25 months, and the mean duration of breastfeeding with complementary feeding was 14.46 months, and also the mean age of the child at the time of the weaning was around 21 months. About the in our results, we separated the child outcomes to the negative child outcomes and the positive ones. Negative child outcomes were including diarrhea and chewing nails, fever, weakness, anxiety, weight loss, constipation, and increased desire of milk powder, which we saw that anxiety and restlessness was reported the most frequent by mother. And the positive children outcomes are increased emotional bond, increased appetite, child independence, self-reliance, increased well-being. It was all based on mother perception. Better weight gain of the child, which most of the mothers mentioned that the child had increased appetite. For maternal outcome, again, we separated the outcomes by negative and positive. We had the checklist, but mothers could also add whatever they had in mind. For example, if they had the outcome that we didn't have in checklist, they could add that. But mostly they chose the ones that were in the questionnaires, and the ones that they mentioned were some mothers very, very low frequency were mentioning different things. For mothers, the most negative consequences of weaning was breast engorgement and breast pain, and the positive outcome, more than half of the mothers said that they felt relieved from breastfeeding complication after weaning. About the weaning methods, we categorized the weaning methods to food substances, chemical substances, and the medication that doctor suggested. Also, we had another question that if mother took any other medication and not by the suggestion of the doctor, but self-medicine administration, which was a yes or no question. That we saw that use of chemicals with 41.2% was the most common method of weaning, and 32.9% of mothers in the research stated that they used the medicine, self-administration of the medicine. Here we have all the weaning methods separated between the non-medical methods, seasoning, and also the use of some of these chemical methods like toothpaste and nail polish, but really more frequent than the others. And for self-administration of the drug, we had different items like hormonal medication, like common cold medication, and also there are some special medication that are used in Iran, just to, for example, chloride potassium drop, which most mothers use for making the milk bitter. But here we saw that the percentage was not really a lot. So outcome of different methods of weaning for children, we had that we got the result that we were now here. We are actually investigating if there is any relationship between these methods of weaning and outcomes that are reported. So here we are just investigating that if we saw any relationship or not. For our children, we saw that medical methods of weaning had no statistical correlation with positive and negative child outcomes. Also, non-medical methods of weaning were only correlated with child's fever and lethargy, and most of with food substances, chemical substances, and medicine prescribed by doctor were self-reliant, which was one of our positive outcomes, and only 27.6% of children who were weaned from other methods, such as Affiliation, they were reporting to be more self-reliant. And the reason might be the age of these children, because our average of the age was much higher than 2 years. So being self-reliant can be attributed to that. For maternal outcome, non-pharmacological and medical methods, the doctor's recommendation had no significant relationship with positive maternal outcome, and the medication methods of weaning had only a significant relationship with mother's breastfeeding fever and also with engorgement. Medical methods of weaning had no statistically significant relationship with positive maternal outcomes. So in discussion, breast milk has short and long-term benefits for the development of infants' nervous system, and weaning a child is psychologically important for infants and children, because during weaning the child loses the main source of the oral pleasure, and there seem to be a lack of consequences regarding the time of the weaning. Nevertheless, the process of weaning should not be traumatic for the child. In Iran, an authentic text of traditional medicine, breastfeeding is recommended for up to 1 year and 9 months, and at maximum for up to 2 years. And also continuation of milk consumption in traditional medicine for more than 2 years has been associated with complications such as mental retardation of the child. In this study, the mean age of the child at the time of complete cessation of breastfeeding was 21 months. And from Iranian studies, it can be concluded that many Iranian mothers wean their children around 2 years of age because they think the duration of breastfeeding is adequate, which fortunately is accordance with the WHO and AAP recommendation. Also, many mothers use the different methods of weaning. Some of them can be potentially harmful, like betadine, and when mothers want to wean, they face so many problems. They don't know how they should do the correct way of weaning, and they ask recommendations of their relatives, and they frequently use traditional methods. In many studies in Turkey, there were similar results that mothers were using substances that were unpleasant for the children, like traditional methods, and these traditional methods actually were very similar to Iranian studies. Weaning methods play an important role in the nutritional health of children in the future. Traditional methods that include changing the um, taste of the milk and separating the child from mother suddenly, and also all this inappropriate, potentially harmful weaning methods can weaken the bond of trust between mother and child and can cause adverse effects for children. In a study similar to our study, which was in another city in Iran, mother who gradually weaned their children used traditional methods such as sticking glue, which was also very common in our study, like black, electric, or also they use pepper, or they use hair on the breast, or changing the nipple taste, and using black color on the breast, which was not reported in our study, and drops for making the milk bitter, and other traditional methods. Also, some Iranian doctors still recommend that it would be a solution to make the milk bitter, and they might suggest some of these traditional practices. So considering all of the points, it can be concluded that the use of traditional methods in Iran is pretty common, and generally it is being done, and the aim is to scare the child and reduce the desire of the child for breastfeeding. Improper implementation of weaning can make the child prone to malnutrition and diarrhea. Based on the studies, the most common outcome of weaning children with inappropriate methods was anxiety and restlessness and weight loss. Diarrhea is also one of the commonly reported outcomes of weaning, and the possibility of child suffocating after stopping breastfeeding also is one of the problems and outcomes of weaning, which was not reported in our study, but must be considered. Also, for mothers, breastfeeding has many beneficial effects also on the mother's mental health, on mother's mood, and breastfeeding relieves discomfort caused by childbirth and creates a positive maternal feeling. Breast milk is not only of great value and importance for physical and mental health of the child, but also very important for nursing mothers. And it reduces the incidence of diseases like heart disease, obesity, and psychological issues like stress and depression. Weaning from breast is often difficult for both mothers and children, and a mild form of postpartum grief often occurs, and it is exacerbated when the mother lacks the necessary emotional support. Weaning complications for mothers that were mentioned in different studies were painful breast engorgement that was very similar to the study, mastitis, re-pregnancy, and depression, and also maternal guilt, sense of loss and sadness after weaning. But unfortunately, there were not so many studies that report the positive outcome of weaning. So to our knowledge, maybe we were one of the first people who mentioned the positive outcomes of weaning too. In conclusion, the result of the study showed that a high percentage of weaning was done with inappropriate methods. In this study, sometimes mothers who were not meeting the criteria for entering the study were asking the researchers about the methods, the correct method of weaning their children, and they were curious to know what are the correct process and what is the correct form of weaning. So we were thinking that maybe health education by health worker can be very useful to decrease this inappropriate methods, and also maybe maybe having a formal weaning guideline which is based of evidence would be a valid approach for all these health workers to know how to help mothers and how to help mothers cope with weaning and the challenges that weaning has. These trainings should be community-based. Of course, they are different in different countries. For example, a country like Iran might have much more incidents of traditional weaning methods than Western countries. And our suggestion is that the study would be more community-based and also considering the small numbers of the studies that are actually talking about weaning problems, we suggest that more studies would be conducted about the impact of weaning education on mothers and mothers' performance and attitudes. Our research team suggests for future researcher to conduct a combined study to measure the effects of a standard weaning program on prenatal and childhood variables. And it is also suggested that effective training and effective training for investigating the traditional methods would be conducted, and checking if the mothers practice less traditional weaning after this effective training. At the same time, comparative studies to measure the consequences of weaning with traditional methods in Iranian society also can be helpful. Thank you very much. Please, if you have any questions.
Thank you so very much, Dr. Bahar Hassan, for that eloquent presentation.
Thank you.
You have given us knowledge